Hello everyone and welcome to a new video. So continuing our discussion about antibiotics, now we are going to talk about the urinary antiseptics. So urinary antiseptics used to treat urinary tract infections, UTIs. UTIs are one of the most common infections affecting humans, and in this video we will talk about the antiseptics. But we will start by talking about a short summary or a brief summary of the UTIs. We will talk classification, we will talk presentation, diagnosis and treatment of UTIs. Then we will go and talk about nitrofurantoin, methenamine, fosfomycin, which are urinary antiseptics. And finally, we will talk about the dosing of these drugs. So this is my Patreon page for people interested in supporting this channel. Your support will help creating better videos, and it is very much appreciated. So if you want to support this channel, please consider donating through Patreon, and the link will be available in the description box below. So let's start by talking about the urinary tract infections. So first, let's start with the classification. So classification of UTIs. So UTIs are classified into lower urinary tract infections, and those are infections of the bladder and the urethra. So bladder and urethra, and we have infection of the upper urinary tract, and that include the kidney and the ureter. Regarding the presentation of urinary tract infections, so patient presentation, we also have the lower UTI presentation and the upper UTI presentation. The lower UTI present with a triad of dysuria, meaning pain during urination, plus dysuria plus suprapubic pain plus frequency. Other symptoms include hematuria, and urgency. The upper UTI, on the other hand, would be present with flank pain, also a triad of flank pain plus fever, meaning elevated body temperature, plus the costovertebral angle tenderness. So costovertebral angle tenderness, and that is during examination of the patient. We have also other symptoms like the nausea and vomiting. Regarding the causative organisms of the UTI, causative organisms, those include the E. coli, which is in 80% of cases. We also have the Proteus, the Klebsiella, and also include the gram-positives like Strep and Staph. But mostly it's a gram-negative pathogen like the E. coli, the Proteus, and the Klebsiella. The E. coli is transmitted from the GIT tract, and that's through the anus. It would be transmitted to the urinary tract and it would cause infection. The diagnosis of the UTI, so DX, is by urine analysis, and dipstick testing, and those which show pyuria. This is the most specific for UTIs. Pyuria is, if it is more than 5 in males, it confirms the UTI infection, and if it's more than 8 in females, it would confirm the UTI. The RPC is less specific for UTI. Also, we have the nitrite and the leukocyte esterase. Those are specific, but they only occur with certain organisms. So if there is no nitrite or leukocyte esterase, it does not exclude the urinary tract infection. Regarding the treatment of UTIs, so treatment, we have the upper UTI first. So upper UTI. To treat upper UTI, the antibiotic has to be bactericidal, and it has good concentrations in blood and urine. So good concentrations in blood and urine to treat the upper UTI. And examples include the penicillin, the third and fourth generations of the cephalosporins, the aminoglycosides, the second generation of the quinolones, we can't use the vancomycin because it covers only staph, and the most common causing organism of the UTI is the gram-negatives, so we can't use the vanco. So let's see here, can't use. Vanco is the first one. We also can't use the tetracyclines and the chloramphenicol. So tetracyclines and chloramphenicol, because both secreted as inactive in the urine, inactive metabolites of the drug. We can't use macrolides because they are secreted in urine in low concentrations. We can't use macrolides. And we also can't use the cotrimexazole because the cotrimexazole is bacteriostatic. So we can't use it. We need a drug that is bactericidal. Regarding the treatment of the lower UTIs, so lower urinary tract infections, the antibiotic can be bacteriostatic or bactericidal. It's okay for both, and it does not have to have good concentrations in the blood. It only needs good concentrations in urine. So the nitrofurantoin, which is urinary antiseptic, nitrofurantoin, is the first line in treating lower UTIs. We also can use any other antibiotic that achieve the rules. We can use the amoxicillin. It has good concentration in urine, and it's a penicillin. We also can use the cotrimexazole because it's a combination of trimethoprim and a sulfonamide, and it's a bacteriostatic, and it has good concentrations in urine, so it is a good, it can be a good choice. Now let's talk about the urinary antiseptics. Examples for the urinary antiseptics include the nitrofurantoin, the methenamine, and the fosfomycin. And we have others. All of the urinary antiseptics are oral agents. So all are oral agents, and they don't have significant plasma concentrations. They are excreted quickly into urine, so they don't sustain significant plasma concentrations. They are excreted directly to urine, so excreted to urine in high concentrations. And that's why they have little or no systemic effect. So they only have effect in the urinary tract. They are used only in treating lower UTIs. Since the upper UTI require antibiotic that have good concentrations in blood and urine. And the urinary antiseptics, they have good concentrations in urine only. So they are used in treating lower UTI only. So the upper, they can't treat that. And they are used in treatment, treatment of lower UTI, and they are used also in prevention of recurrence. And that's in people who are highly susceptible to getting their urinary tract infected. So prevention of recurrence of UTI. Now let's talk about each of the urinary antiseptics, and we will start by the nitrofurantoin. So let's start by talking about the pharmacokinetics of the nitrofurantoin. So pharmacokinetics. So again, the nitrofurantoin is oral only, and it is well tolerated by the patient, and it has rapid absorption, and it works better in acidic urine. So more effective in acidic urine. The mechanism of action of the nitrofurantoin is by inhibiting DNA and RNA in the bacteria, and this would give it a bactericidal effect. So bactericidal effect for the nitrofurantoin. Regarding the spectrum of the nitrofurantoin, it works on the E. coli. It also works on the Klebsiella, the Enterococci, and the Staphylococci. But does not work, doesn't work on Pseudomonas and Proteus. So Pseudomonas and Proteus are resistant to the nitrofurantoin. Regarding the uses of the nitrofurantoin, it is used as first line in treating uncomplicated lower UTI. So first line for uncomplicated UTI. And this means, uncomplicated means there is no structural or functional abnormality in the urinary tract. Functional abnormality in urinary tract. Now let's talk about the adverse effects of the nitrofurantoin. So adverse effects. We have the common adverse effects, and those include nausea and vomiting. And we have the rare adverse effects, and those include pulmonary fibrosis, also autoimmune hepatitis, and it can induce a hemolytic anemia attack in patients with G6PD and G6PD deficiency. It also might cause a neuropathy, and those all rare. Regarding the contraindications, the nitrofurantoin is contraindicated in renal dysfunction. Now let's talk about the hexamethyl N-tetramine, also called the methenamine, which is the most common name for this drug, and it also has other names like the hexamine and the urotropin. So regarding the pharmacokinetics of the methenamine, pharmacokinetics, again, as with the same as other urinary antiseptics, it is only available as oral, and it is not well tolerated. So not well tolerated by the patient. It causes GIT upset, and it only works in acidic urine, only works in urine pH less than 5.5. And to maintain urine acidity, the methenamine is combined with weak acids like the mandelic acid and the hippuric acid, and we get the methenamine hippurate if we combine it with the hippuric acid, or we get the methenamine mandellate if we combine it with the mandelic acid. Now let's talk about the mechanism of action of the methenamine. So the methenamine is hydrolyzed into ammonia and formaldehyde. The formaldehyde, and that it is hydrolyzed only in acidic urine. So only in acidic urine it hydrolyzed into ammonia and formaldehyde. The formaldehyde will denatures protein, denatures bacterial proteins, and this would lead to bacterial death. So it is also bactericidal. Regarding the spectrum of the methenamine, so spectrum, it is active against E. coli, enterococci, it is also active against staph, and it has some activity against Proteus and Pseudomonas. Regarding the uses of the methenamine, it is mostly used in suppression of recurrence of the UTIs. So it is used to suppression of recurrence in people who are more susceptible to UTIs. Regarding the adverse effects, so adverse effects of the methenamine, it causes GIT upset in form of nausea, vomiting, and others like diarrhea. With high doses of the methenamine, so high doses, it causes irritation to the bladder, and that lead to chemical cystitis. So chemical cystitis, and this would lead to hematuria. Regarding the contraindications of the methenamine, so contraindications, it is contraindicated in children less than 6 years of age, and it is also contraindicated in renal insufficiency. Regarding to interactions of the methenamine, so interactions of the methenamine with other drugs, it interacts with the sulfonamides, the formaldehyde, which is the metabolite of the methenamine, it would interact with the sulfonamide and it would lead to crystal urea. So crystal urea. Now let's talk about the fosfomycin. So the fosfomycin, we start with the pharmacokinetics. The fosfomycin is also oral agent, and it is well tolerated like the nitrofurantoin, and it works better in acidic urine. So work better in acidic urine. The mechanism of action of the fosfomycin, so mechanism of action, it inhibits cell wall. So inhibit cell wall of the bacteria, and this would give it a bactericidal effect. So bactericidal effect. The spectrum of the fosfomycin it works on the E. coli. Also, it works on the enterococci and the Proteus and the Citrobacter. Regarding the uses of the fosfomycin, so uses, it is used in treatment of UTIs and used for treatment of prostate infections. Prostate infection. Regarding the adverse effects, we have the common adverse effects. Those include the GIT upset in form of nausea and vomiting. And we also have the rare adverse effects, and those include the allergic reactions, and we also have the Clostridium difficile colitis. So it causes Clostridium difficile colitis because it kills the intestinal flora, and it leaves the resistant organisms in the intestinal flora, including the Clostridium difficile. This would lead to the Clostridium being more dominant, and it would degrow really quickly, and this would lead to Clostridium difficile colitis. This would be present as abdominal pain and diarrhea and treated with metronidazole as a first line and vancomycin as a second line. Finally, let's talk about the dosing of the urinary antiseptics. We will start with the nitrofurantoin. So nitrofurantoin. The dose of the nitrofurantoin is from 5 to 7 milligrams per kilograms per day, and that is divided into 4 times. The dose is divided into 4 times per day. And the nitrofurantoin is available in 25, 50, and 100 milligrams formulations. Regarding the fosfomycin dose, it is dosed as 3 grams per dose and per day. So it's 1 dose per day and it's 3 grams. And finally the methenamine dosing is methenamine has complicated dosing, and it is better to look it on the Medscape page. It has a lot of details to know about. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like and subscribe, and see you in the next video. Peace.